Hi everyone, this is the part 2 of health education. Learning outcomes demonstrate skills involved in planning oral health education, use health education goals to plan content and method, discuss evaluation methods of health education activity. Introduction. For the oral health educator, communication involves sending information to a patient in a way that they can easily understand, remember, and act upon. It is vital that patient receives the same message that is sent. Being able to communicate messages to a variety of patients, some of whom want to hear it and others who do not, is tantamount to success for the oral health education. As is breaking down any communication barriers that may exist. Most patients will have experienced occasions on leaving the surgery of doctor or dentist or other health professional feeling annoyed, confused, or even more nervous than when they arrived. The ones to put the patient at ease, answer questions truthfully, and explain points positively, clearly, and concisely lies with the professional. It is not the patient's fault if a message is not understood. It is therefore important for oral health educator to know a little communication theory. The three rules of communication: tell me, I forget; show me, I remember; involve me, I learn. So don't forget these three rules. It is normal to feel nervous and apprehensive when talking to a patient. However, once you have talked to the person, found out a little about them, and planned what steps are required, the second visit will not be nearly as intimidating. Remember that the patient may be more nervous than you are, and they are there because they need your knowledge and help. Communication takes place at two levels. First is cognitive, that is getting the oral health messages across. The second is emotional, related to the feelings, how the message is conveyed. In dental situation, the later is more important. Effective communication makes it easier for patients to discuss problems in relaxed, unrushed way in order to devise solutions. It should be a positive, non-threatening, unpatronizing experience which facilitates message delivery and behavioral change. Always greet the patient warmly, introducing yourself with a smile, and invite them to remove outdoor clothing and take a seat, preferably in comfortable chair in setting free of dental equipments and free of noise and good smell. Advice should be clear, concise, evidence based, and consistent with the health messages given by other health professionals. OHE should use open questions, be encouraging, and tailor messages to the individual circumstances. There are three main aspects of effective communication that oral health educators should be practiced, that is warmth, empathy, and respect. Coming to warmth. Warmth is communicated primarily through a non-verbal behavior, that is active listening, eye contact, head nodding and body posturing, facial expression, other non-verbal signs of interest, attention. Whatever patient is telling, you have to hear carefully. And there should be an eye contact with the patient, and your expression should be always smiling. Then others non-verbal signs. See, if I'm telling always smiling means if patient is telling in pain, you should not smile. You should make them calm. Good non-verbal behavior would include sitting or squatting while facing the patient, leaning forwards gently with the legs uncrossed, nodding and smiling at their level. Empathy. Empathy means perceiving and understanding a situation from the viewpoint of another. Empathy conveys the message I care enough to try to understand your feelings and point of view. Come to respect. Respect is an awareness that patients are entitled to have their own feelings, perspectives, and expectations, and make decisions on their oral health, treatment, and management that may differ from those of profession. Respect does not necessarily imply agreement. It also involves taking into account issues that relate to diversity and equality. Care about your patients, be nice to them, and hopefully they will try to do anything that is asked of them. Communication barriers like social barrier, like dress, language, accent, cultural barriers like hygiene, nutrition, then language, like patients that do not speak or understand or have little knowledge of English, then age, gender. So these are some of the communication barriers. So limited receptiveness of patient versus negative attitude towards the oral health educator. So mental health condition of the patient, then negative attitude towards the oral health of previous bad experience. Limited receptiveness of patient includes like illness, tiredness, pain, anxiety, busy or distracted, low self-esteem, not being interested in keeping healthy or looking after their tooth. These are limited receptiveness of patient. Some of the are there, they are negative attitude towards oral health educators. Some patients are like that. Like maybe because of their previous bad experience, they never trust people in the authority. They see the educator as a threat, someone who will criticize or judge. An oral health educator example conflicts with the advice. Example educator with halitosis. Patient believes they know it all already. Patient has subconscious wish not to know. So these are the negative attitudes. See, this we have to overcome or we have to speak in such a way. If the patient is having these characteristics, they should remove it. In such a way, you have to motivate. Limited understanding or poor memory. Of limited intelligence, oral health educator uses jargon that patients won't understand. That words are behind their understanding. So we have to tell in their familiar words. Then poor memory may be dementia, insufficient emphasis on education by the professional. It is discouraged, low priority in their practice, of a lack of confidence in the educator's own skill and knowledge, inadequate training to keep up to date, hurried approach, not enough time allowed. So this is problem. These things are done by the professionals. Then contradictory messages. Confusion can arise when patient receives different messages from other health professionals and acquaintances such as dentists, doctors, and well-meaning family and friends. Information fade. Barriers to effective communication can lead to information fade, and many patients come away having remembered very little. It is therefore useful to reinforce the information given by giving a patient a leaflet to take away. Leaflets on many topics can be obtained from the representatives of dental companies or from health promotion units. Oral health educators can also design their own leaflets. Education and planning sessions. When educating a patient, oral health educator pass on their expertise as well as their own feeling about what is being taught. The patient absorbs the information and acquires new knowledge, skills, and attitudes. The information given to the patient should be based on the accurate, up to date, evidence based research rather than hearsay. Education theorist. Tone's model for health promotion, which was given in 1993, emphasized that illness is not the responsibility of the individual alone, that many factors contribute to it, including social and environmental circumstances. Another theorist called Tannehill produced a model of health promotion concerned with three main areas. First is health education, that is educating the children in healthy lifestyles. Then health prevention, that is detecting problems such as smoking or alcohol abuse. Then health protection, government legislation in protecting the public health, like drinking driving laws and more recently smoking bans in public places. The three domains of learning. Before structuring a session, the oral health educator must decide upon what learning domains their session falls into. The three domains of learnings are knowledge related to cognitive, that is receiving new information or explanation and thus increasing knowledge. Attitude related to forming and changing attitudes, beliefs, values, and opinions. Then behavior, which is related to acquiring and improving new skills. The first is knowledge, that is new information which is if you are giving to the patient. Then you, after listening to that information, patient has to change his attitude and behavior. Then he has to practice whatever you have taught to them. So these are three domains. You have to decide which one you want to stress for which population before your health talk. The stages in planning sessions are decide upon the topic, first thing. Then obtain background information about the patient or the target group. If you are going for a community talk, you should know who is your target and what is their level of understanding, their level of knowledge about what you are going to speak. So that things you have to assess at least prior to your talk. Write your aims and objectives. Create a lesson plan, teaching method and aids, plan assessment and evaluation, and rehearse. Always try to rehearse. Decide upon the topic. This will be either specific to an individual, related to the problem with their own oralizing, or relevant to a large group. For example, talking about the snacks to children. When choosing a topic, it is usually best to stick to one area so as not to overload the audience with too much information at the same time. Obtain background information about the patient or a group. When planning an oral hygiene session, the oral health educator should take into consideration the following points. Size of the audience. If it is too big, individual attention can't be given. Prior knowledge of the group or individuals. Subject relevance. Is the topic meeting their needs? That you have to keep it in mind. Timing. If it is too long, leads to boredom or distraction. So you have to minimize the time. It should be short and sweet. Special needs, example physical or mental health conditions. If you are educating the special need children or the adults, you should be very careful. You have to accommodate to their illness. If you are giving health education for the dumb, it's different. If you are giving health education for the deaf, it's different. So you should know your target group. Learning abilities, that is intelligence level. So you should know that whether your target is intelligent or moderate or poor intelligent. Ethnicity of groups, language and cultural barriers. So sometimes there will be cultural conflicts. You should not speak that. So you should be very careful during your talk. Each word you have to talk clearly and it should not hurt their inner feeling of the culture or religious things. Social class. Bear in mind what products learners can afford to buy if a requirement. For example, a village guy, if you are telling him to buy a salivary uh, spray or something like water spray floss or water floss, first of all, you don't know what is floss. And in the meantime, if you are suggesting him to buy a water floss, you won't buy. So you should know the social class. Aims. An aim is a statement of intent, purpose, or goal to achieve something and is quite often general and non-specific. It should include what the patient needs to know. Aim should be brief, clear, simple, comprehensive, covering all the material to be taught in session. For example, I aim to teach this patient how to brush effectively. So you have to limit to the brushing. Objectives. It should be specific, it should be measurable, it should be attainable, it should be relevant, it should be time related. You can remember it as SMART. Specific means state exactly what the patient will achieve. Measurable. There will be a means of testing new skills, knowledge, or attitude. Attainable. The learning ability of the patient must be considered. Relevant. Relevanting to what you want the patient to achieve. Time related. What is achievable in the stipulated time available. So these things you have to set before only. Lesson plan. All lessons, no matter how short, need a plan. A plan enables the educator to keep to the topic, refer to the objectives, keep to the teaching method, keep to the time scales, assess how well the patient learned, evaluate the lesson. Teaching methods and aids. The oral health education should be aware that oral health educator should be aware that there are many teaching methods and that not all patients respond to the same approach. For example, some patients like to demonstrate what they have learned back to you, others will not. Some patients remember points better if they are written down for them. Experience will gradually help the health educator plan and vary methods of teaching accordingly. Resources and motivational aids should be relevant and simple to use, demonstrate. Rehearse the session. It is imperative to rehearse the session using friends, families, and particularly colleagues. This will help you iron out any problems and judge the amount of time needed. Be prepared to take positive criticism and adapt your session accordingly. Coming to evaluation, it can be defined as making a judgment about the outcome and effectiveness of an oral health education session or program. There are many types of evaluation. We are focusing on these things only, like outcome evaluation, process evaluation, patient evaluation, peer evaluation, and self evaluation. Outcome evaluation. What will be the outcome of the session? Will patient increase their knowledge or change in their behavior or attitude as a result? So this we have to evaluate. Then come to the process evaluation. This is concerned with the session delivery as it happens. Is the teaching process going well? What is the patient telling you? This can usually be surmised by the patient's reaction or the signals they are giving. Observe nonverbal feedbacks, facial expressions, and body language. Do they look interested and attentive? Are they fidgeting and looking out of the window? From the learning to spot the signs, it is possible to continually process to evaluate and adapt a session accordingly. Patient evaluation. Take on feedback at the end of the session and be prepared to modify your teaching in future sessions. Peer evaluation, feedback from colleagues, ask for comments and suggestions to improve future session. Self evaluation, that is reflective practice. Look at your performance after a session. How well did it go? What worked? What did not? And why? How could the session be improved? It is good idea to keep a reflective practice notebook, noting down the notes about what happened immediately after each session. This enables you to identify problems and improve performance. Patient evaluation. Take and feedback at the end of the session and be prepared to modify your teaching in future sessions. Peer evaluation. Feedback from colleagues, ask for comments and suggestions to improve future sessions. Self evaluation. Look at your performance after a session. How well did it go? What worked? What did not? And why? How could the session be improved? It is a good idea to keep a reflective practice notebook, jotting down notes about what happened immediately after each session. This enables you to identify problem and improve performance. I think that is noting down, there is a spelling mistake. Evaluation methods. There are many methods, but whichever one you choose, bear in mind that method must relate back to your aims and objectives and show whether the goals were achieved or not. Question and answer session with the patient. Have your questions written down in the advance so that you can refer to them in case you need it. To keep them simple with an emphasis on getting straightforward answers. Skillful questioning will help patient give full, clear, honest answers. Patient demonstration of new skill, that is visual evaluation. Records of behavioral change. Example, plaque scores, indices, documented decrease in caries rate. This will be evaluated on return visits after the patient has carried out your instruction over time. Help from the dentist or hygienist may be required here. Questionnaire. Get the patient to fill out the questionnaire after the session. So this is about how to plan and how to evaluate. The next is planning an oral hygiene presentation to a group. Planning a talk to a group outside of the practice. When planning a talk outside of the practice means in your dental clinic, outside the dental clinic. And health educator should be visit the venue in advance on preliminary visit. Check whether car parking is there, what is the access, whether public transport is linked to the destination, position of the rooms, being mindful of any medical potential condition of attendees, example, room accessibility, then fire protocols and exits and other housekeeping safety procedures, facilities specific to the venue and brief attendees accordingly. Size of the room, is it sufficient for the number of attendees? And lighting, bright enough or it is dark? So that you have to check. Electrical sockets, sufficient and in the best place for the needs. Then fixtures and fittings, chairs, sinks, mirrors, that are the fixtures and fittings. Then resource available like computer, projector, screen, flip chart, table, pointer. So you have to check all these things. Then refreshment and facilities like kitchen or bathroom, a dustbin. You have to check everything before you start a program or to educate the people. Book a date with the venue owner or organizer. Obtain a proof of booking where applicable and confirm the booking near to the time. Obtain a background information on the group from the group leader or teacher or community leader. Work out the cost, keep within the specified limit. Decide upon the topic, aims and objectives, lesson plan and evaluation. Connect visual aids resources. Rehearse the talk using colleagues, family, and friends. Take on board constructive criticism. Delivering the talk. This is the checklist on the actual day of the talk. Check that and double check you have everything before leaving from the for the venue. Arrive early. Try to arrive early. Ensure the room is arranged as required. Set out the resources. Welcome the audience. Introduce yourself and anyone else involved in delivering the session. Go through housekeeping of venue. Tell them what you are going to cover and format or the length. Speak slowly and clearly so that everyone can hear. If you want, you ask them whether you are audible to them or not. Encourage group participation. Use a variety of teaching methods. Avoid technical jargon. Encourage motivation and awareness. Allow supervised practice of new skills if it is applicable. Reinforce learning using handouts or leaflets. Summarize what you have covered. This is very important. You have to summarize. That time, it's like repeating, which will make them to remember what you have taught to them. Finish on time. People get restless if session overruns and have a suitable breaks. Arrange a written visit to follow up on learning if possible or if required. Remember to thank the group for their attention, teachers or group community leaders for their help, and colleagues for their support if applicable. Leave your contact details for attendees in case they have subsequent questions. Leave the venue as you found it. Setting up an exhibition or display, how it should be. Decide upon the topic, aims, and objectives and target groups. Decide on the type of exhibition, example, notice board, freestanding, computer program. Consider lighting and position of the exhibition, maximize its visibility. Consider the height of those who will view it. Set up tables if needed. Make the exhibition simple, high catching, and interesting. Organize information in short section under clear headings. Arrange times to stay with the exhibition and talk to the public patiently. Prepare and supervise an evaluation method. That's all about that. Then coming to poster design and displaying and written information. Experiment with the color combination. Example, yellow on black shows up well. Yellow on white is not good. Red is eye catching, but too much red may be overpowering. So you have to check the combination of the colors. Try to limit the colors also. Don't put too many colors. Write clearly and large enough for the information to be read easily. Consider word processed material which gives text clarity, especially for those with less neat handwriting. Vary the color and size of the text for extra emphasis. Do not write too much. Concentrate on the main message and leave sufficient white space to help make your points clear. More detailed information can be given in the form of leaflets. So, these are the things about oral health education and roles and responsibility of oral health educators. If you have doubt, please contact me, and if you are free to ask any question if you have doubt. Thank you.